All right, let's get started. Good evening, everyone. My name is Akil Kaitherpal, and I'll be moderating tonight's webinar entitled Part 1 of the 2016 IR Residency Training Committee webinar series for medical students, Gearing Up for Applications. I want to thank everyone for attending this evening, and I want to give a special thank you to all the panel members for volunteering their time to participate. We know you guys all have a lot of questions about the upcoming application process, and we just wanted to provide you guys with a forum where you can speak directly to residents and get their perspectives on the application process and interview process from folks who have been through it themselves. As far as the agenda for tonight's webinar, we'll start with a brief summary of the new training pathways. And even though the main purpose of this webinar, again, is to gain perspective from residents on the application and interview process, and not so much on the actual logistics of the new pathways, we still wanted to provide you guys with some background information on those new training pathways. We'll then go into an introduction of our panel members, followed by a frequently asked questions section for our panel members, and then we'll go to audience submitted questions for the panel. As far as some ground rules, we're going to mute all but the panelists' mics throughout the webinar to minimize background noise. Please type into the chat box if you have any questions or comments. Everything that is discussed during the webinar will be recorded. If there's any part of the webinar that is inappropriate or irrelevant to the discussion, it will be removed from the webinar before it is publicly posted, but everything will be anonymous as well. Please select myself, Akil Kaitherpal, from the chat box drop-down menu and send questions directly to me. If you do not select an individual, any question you ask will be visible to all other attendees. And please refrain from asking questions at the beginning, since it may be covered during the first part of the webinar. So to start, we'll go over a brief summary of the new training pathways, starting with the Integrated IR Residency. And this is the program where you're going to apply directly from medical school. It's going to have a 1-year internship followed by a 5-year residency for a 1+5 model. Typically, the residency will consist of 3 years of diagnostic training and 2 years of IR and IR-related rotations, such as cardiology, vascular surgery, medical and surgical oncology, and transplant surgery, as well as at least 1 month of ICU experience. There's going to be some flexibility for programs to determine when the IR and IR-related rotations take place during the integrated residency. The next program is the Independent IR Residency, which is going to function similar to the current fellowship model, and that's going to be designed for those who chose to pursue a career in IR towards later in the residency, also for those who chose to pursue a career in IR, as well as further explore other interests in DR during the 4th year of their DR residency. And this can either be a 2-year IR training program after a conventional radiology residency for a total of 7 years of training, or a 1-year IR training program after completing an ESIR-approved training program for a total of 6 years. And what ESIR is the early specialization in interventional radiology. And the ESIR is completed within a DR residency, which allows residents who have completed a DR residency, including the requirements of the ESIR, to then pursue a 1-year independent IR residency training path, which would be a 1+4+1 total training time, rather than the 2-year independent IR residency. And the training for the ESIR consists of a total of 12 IR or IR-related rotations during the 4 years of a DR residency, along with 1 month in the ICU. And most programs will have the bulk of those rotations in the R4 or PGY5 year. Okay, so next we're going to do our resident panel member introductions. And what we'll have you guys do is just go ahead and introduce yourself, say where you're doing your training now, what year you are, and also what you did for your intern year. And we'll start at the top here with Alex.
Hi everyone, my name is Alex Joe. I am a R2 at the University of Michigan in the IR residency, and I did my internship in Hawaii in surgery.
Hi guys, I'm Nikki Keefe. I am a PGY3 R2 at the University of Virginia in the IR pathway. So I did my general surgery intern year at UVA.
And we'll have Rupal Park joining us. She is currently doing her intern year in general surgery at Mass General Hospital, and she will be doing her residency at University of Pennsylvania in the IR residency program there.
Hi everyone, my name is Andy Niekamp. I am an R2 PGY3 at University of Texas at Houston, and I did my intern year in preliminary medicine at Riverside Methodist in Columbus, Ohio.
And we're going to have Shantanu joining us later. He's actually on call tonight and is going to help us out as soon as he can join on. And he is currently doing his intern year in general surgery at the University of Pittsburgh and will also be doing his radiology residency at the University of Pittsburgh.
Hey everybody, my name is David Maldow. I'm currently an R1 at University of Rochester, and I completed my intern year in medicine at Albert Einstein Jacobi Medical Center in Bronx, New York.
And my name is Akil Kathirpal. I'm currently a R3 at Virginia Commonwealth University, and I did my intern year in general surgery at the University of Virginia. Okay, so we're going to go on to our frequently asked questions for the panel portion of our webinar now. We're going to go over some questions that we've come across kind of pretty frequently in our experience so far, and we'll go ahead and ask the panel members what they think about this. So first question, what key parts of the ERAS application do you think program directors are looking for? And we'll go ahead and go Andy, David, followed by Nikki and Alex.
Okay, so I think one of the things that the program directors in the integrated residencies upcoming are going to look at is a continued interest in interventional radiology. I know that talking to a lot of them at the annual meeting last year, they want to see somebody who they've seen continued commitment, and by getting involved with the National Society, by getting involved in research projects, by getting involved with the interest groups within their own medical school, and they want to see that this isn't someone who's just recently gotten involved prior to their admissions process in order to bolster their resume. They want to see so they want to see someone who is genuinely interested in this. I think that's going to hold a lot of weight, especially as these integrated programs start to get off the ground. They really want dedicated medical students. But again, just like every competitive specialty, board scores and your grades are really going to be very important. So definitely work hard during your clerkships. Make sure you study for your board applications, because this is going to be a very competitive specialty. There were 15 spots last year, and there was almost 170 applicants. So just keep that in the back of your mind. But again, continue to show dedicated commitment to the field of interventional radiology would be my biggest advice.
I would definitely agree with Andy, everything that he said. Showing that initiative and commitment to the specialty, being that this is a new IR residency, is critically important. Another thing I would just add outside of IR is just if you have any particular talents or interests that you've had growing up or even today, I think those things also are worth mentioning and including, because these can be great topics of conversation, and they also show that you have a commitment to something even outside of medicine, and can show your dedication to something as you would be for IR as well.
I can't echo enough how much your dedication to IR is important in your application. And even if you don't find out about IR until your 4th year, trying to get involved as much as you can while they're doing an away elective or even a rotation at your school in IR, getting involved in SIR through the Medical Student Council or Residents and Fellows section, getting an IRIG at your school or going to a local regional conference, finding a mentor in your area. However you go about getting involved in IR, they want to know that you're dedicated to this specialty and that you really foresee it as something that you're going to love for the rest of your life. And so whether you do research or shadowing, just try and get involved, and the earlier the better.
I agree with everything everyone said so far. I do think that you have to show dedication to IR, and you have to show that you truly love the field. In addition to everything else, though, I think one thing I want to advise you guys and urge you guys to do is really cultivate your extracurriculars as well. I've often found that a lot of the applicants meet the criteria for scores and just research, but when it comes to actually evaluating the applicant, they tend to focus a lot on what your interests are and other hobbies are as well, and that seems to be the topic of conversation during interviews. So I would definitely say don't lose your hobbies and other interests, and make sure that you put that on your application, because that is something they actually will look at and find you interesting.
And I agree with everybody, what everybody said here. I think just with like any competitive specialty, grades and board scores are always going to matter. Kind of with the direction the field is taking too, I think strong showing in your clinical rotations, such as internal medicine and surgery, is something that they're going to look at as well. And like everybody else said, is kind of showing interest in the field, showing that you know what the field is about, and that could be through getting involved with SIR, and also research, just kind of showing that you understand what IR is and what the goals of the field are, and it's something that you are committed to. All right, so our next question, would you suggest a transitional year, medicine, or surgery prelim year? And to kind of add on to that, did programs give any recommendations on what prelim year to do? So I'll go ahead and start this one, followed by David, Andy, Nikki, and Alex. So I personally did a general surgery prelim year, and I think I had overall a great experience doing it. It's definitely a challenging year, but I think the biggest benefit for me when people ask like why I did it and what I got from it is there is the OR time, which is always good, but that wasn't the main thing I got from it. The main thing I got from it was being exposed to kind of the clinical management of very similar patients that you see in IR. So I got exposure to clinically managing vascular patients, hepatobiliary patients, trauma patients, things like that. And that was the biggest benefit I took from that surgery prelim year. As far as program directors giving recommendations on what prelim year to do, so keep in mind I applied in the 2012-2013 application cycle, and at that time I had maybe, I think, 2 program directors outright recommend a surgery prelim year, and everybody else kind of said, do what you want to do. But again, things have kind of changed substantially since the time I applied.
So I would agree with that as well. I personally did an internal medicine preliminary year, and going into the application process, my thought process was I wanted to get a strong foundation in critical care management, excuse me, and understanding how to manage these patients from hemodynamic setting and a lot of these conditions that you will come across in IR. And I was also hoping to get some bedside procedural experience as well, using the ultrasound and various line placements, etc. So now moving forward, after having done it, I do believe the ICU experience was tremendous for me, and that will be beneficial. However, I did not get as much hands-on experience as I would otherwise have on a surgery rotation or a surgery preliminary year. And from everything I've heard from attendings, etc., surgery prelim is trending towards what is most recommended at this point.
Yeah, so like David, I also did a preliminary medicine year. Mine was kind of a unique situation. It was at a community hospital in which the preliminary medicine interns were utilized quite often in the ICU. We did a lot of bedside procedures. We were the only ones that covered the ICU overnight. We didn't have an in-house attending. There was actually someone who was in an entirely separate building who was just watching through a camera in the ceiling. So that was very unique. I do not think that those exist very much throughout the country. So, and my personal recommendation broadly would definitely be a surgery year. It just teaches you a lot of the integral management, a lot of how to manage an acutely ill, a very, very sick patient. And that's the kind of patient population that you're going to get in IR. Just one extra thing, though, that I would recommend in your surgery year is to don't forget all the management of all the chronic issues that our patient populations are going to have. As interventional radiology continues to move into a completely clinical primary specialty, we're going to be managing patients long-term, and we're going to need to know how to manage their chronic medical conditions. So that is a skill that I would highly recommend that you try to hone. Definitely in your medical school years, take advantage of all of your rotations, but also in your intern year, try to learn how to do that. As far as programs giving me recommendations, no one during my interview process gave me any recommendations, but I know that a lot of program directors who are going to be heading up these IR residencies do recommend doing a surgery year.
I did a surgery year at UVA, and I would highly, highly recommend it. You need to feel comfortable as an IR fellow and future attending managing patients on ECMO and patients that are potentially coding in the IR suite, and the only way you become comfortable with that is managing those patients in the ICU, and I felt as though I got a lot of great hands-on experience here doing that. In the MICU, maybe you manage cardiac patients and pulmonary patients that are very sick, but it's a different type of sick than those patients that are bleeding out. Another part of surgery that I thought really helped is the radiology aspect of it. In the operating room, you get to see all of the variations in anatomy that happen when you do a bypass surgery or a Whipple or Bill Roth, but those are the things that you're going to be reading on CT or doing in the fluoro suite. And so it really helped understand those things, and I think I had a leg up on the medicine colleagues that didn't see those in the OR kind of going forward in radiology. And then, like everybody said, just take as much time as you can in your surgery or medicine year to get as many procedures as you can. Really coming into IR being comfortable with an ultrasound and with, you know, suturing and stuff really helps.
I have to completely agree with Nikki. I think that surgery is crucial going forward. As IR residency becomes more clinical, it is going to be a very, very clinical field. I strongly recommend that everyone try to do a surgery internship. That being said, I think that not all surgery internships are the same out there in the country. I particularly did a surgery internship that was really heavy on trauma and general surgery, and that had less rotations such as vascular surgery or hepatic transplant surgery, which may have been a little bit more relevant to IR. But that being said, you still look at a lot of imaging, you deal with patients that are gravely ill, and you become very, very comfortable with dealing with sick patients. And I promise you, after a surgery internship, you will never, ever complain about radiology calls because you've been through the worst. So I promise you that. And in addition, I think that surgery gives you that humanistic part of medicine back. And for example, oftentimes in radiology, in diagnostic radiology, we read, for instance, a PET scan and we see metastatic disease. And oftentimes it's just counting numbers and just telling the clinician where these metastatic lesions are. But after you've been on the other side as the treatment team and actually working with these patients, you understand what that diagnosis means. So it makes you a truly clinical radiologist.
All right, awesome. We'll move on to our next question here. So how did you decide what programs to apply to, and what were the key factors that you looked for? And we'll start with Nikki, followed by Andy, David, myself, and Alex for this question.
So I might have been one of those crazy people that made this Excel sheet and ranked every program based on like 20 different factors and the things that were important to me. And you know, for some people that will work, and other people it doesn't work. But some of the factors that I think you need to take into account are whether or not a program has fellows. If a program has fellows, you're going to see all of the crazy cool things that they draw in, but you might have to wait in order to do some of those procedures. If a program does not have fellows, as a lower level resident, you're going to be able to do a lot of stuff, but they also might not bring in the volume and the breadth of procedures. So one thing that I really wanted in a residency was to see everything, including all of the vascular cases, because when I'm an attending, no matter where I am or what I'm doing, if something comes into the ED, I want to be able to manage it and not have to transfer them to a different hospital because I didn't learn that in fellowship or in residency. You want to understand how their relationship is with the different specialties throughout the hospital that you're going to be working closely with, specifically like vascular surgery and oncology, because you have such a close relationship with those specialties in IR. And then not only is it important to understand the IR part of that program, but you need to do well in diagnostic too, because you're dual certified. You need a program that's going to be strong in both, and figuring out what those programs are can be challenging, but ultimately you do have to pass the radiology boards, and radiology is such a fundamental part of IR that you have to be good at that too. So look for a program, or try to, that's good in and strong in both aspects.
Yeah, I would totally agree with everything that Nikki just said. My situation was a little bit difficult. I couples matched with my fiance, who was an anesthesia resident, and we just kind of looked around the country and really shotgunned the country as far as programs. But when it came down to it afterwards, the things that I looked for in a residency program that I really liked were number one, like what the camaraderie of the class was. I really wanted to go somewhere where the residents seemed to genuinely get along, weren't putting on a face during the interview dinner just to act like they were friends. You could actually tell that they were friends. That was really big with me because I think having that kind of team mentality is really important in medicine, especially as we move forward into multidisciplinary teams. Personally, for me, I really wanted to go somewhere with a strong interventional oncology program. I'm really interested in oncology, so that was a big issue for me. So if you're very interested in a particular aspect of IR, you know, maybe you can look somewhere that's very strong in that. But like Nikki just said, I think something that's very important is to make sure that you go somewhere where diagnostics is also strong and where the surgical specialties are very strong, because you know, as IR is moving towards a primary specialty, but we still do work as consultants a fair amount, and the stronger your co-departments are and the stronger the surgery departments are that are going to be referring to these patients, the better cases that you're going to get, better relationships you're going to build, and the better you're going to learn. So that's another thing that you might not think about that is actually comes in to be an important thing. So I would really just look for a well-rounded place, and do not sleep on diagnostics. It's incredibly important, and it's crucial to you being the absolute best interventional radiologist that you can be, is learning how to interpret films.
Yeah, and for me, these are all absolutely true. I liked, when I went to, as far as picking programs, I was looking for a program that had quite a bit of volume and diversity in pathology. So some of the larger programs personally, but I do believe you can get a great education in a smaller program and have more hands-on opportunities, like Nikki was saying earlier on. And in addition to that, once I was in the interview stage, like Andy had said, a close-knit group was really important for me. Getting along with people, these are people that you're going to grow with for the next 4 or 5 years, and work together to accomplish your goals. So that was of critical importance to me. And yep.
Yeah, and for me personally,
Yeah,
as far as
so,
the, oh, sorry, I'll go ahead, Alex, and then I'll go ahead. Okay, great. So for me, the objective things that I was looking for are, I wanted a program that had a large IR department that kind of had the full breadth of IR procedures, still including arterial work. I definitely wanted a big level 1 trauma center. I have a personal interest in IR and trauma, and I wanted to make sure I'd be in a place training where I'd get good exposure to that. And like everybody else said, I just wanted to make sure that there's a place where, aside from the objective things, just there's a general sense of camaraderie, everybody got along well, there's a good working relationship with the attendings and fellows as well. And just kind of putting those things together is how I came to decide on my program.
Yeah, I have to agree with everyone else. I think that there are very important things when it comes to selecting a program. Things like how much research is done, the prestige of the program, and the diversity of IR procedures you get to do, and the relationship you have with the other services. And for me, I did start off with an Excel file like Nikki did, but it fell apart really, really quickly for me. After the first one, I think I just threw it away. I went by how I felt about the program, and as cliche as it may sound, I just, what my heart told me, I pretty much ranked. And for me, the main thing was that I had to be working with good people. And I think one of the best things and the hardest thing about radiology, especially diagnostics, is that you're working with that individual for 8 to 9 hours straight a day. And you really have to like that person, may it be a resident you're on call with or the attending you sit with and staff out all day long. So that's very crucial. And I wanted to make sure that we got along outside of work as well. I liked the programs that actually had fantasy football and played intramurals and had a lot of happy hours. And I think that was something that I was definitely looking forward to coming here. And also, I'm really into eating out, so restaurants was very important, and I'm a football fan, so Michigan was a good choice for that. So definitely do not ignore the things that are important in your life, and make sure to look for those things in the programs you apply to.
All right, great. Let's go on to our next question here. Should I apply to both DR and IR programs? So we'll start with David, followed by Andy, followed by Nikki, followed by Alex.
So yes, I would strongly encourage you to apply to both programs. IR, as it's relatively new, and it's going to be a very popular, and I also believe applying to both is important, given the that there's not as many programs right now, and there's opportunities to get into IR, as we will speak about over the course of the webinar, from diagnostic radiology. For me, for example, I applied the year after the IR, or the year before the IR program started accepting applicants. So I'll be applying towards the independent pathway. And so there are multiple different ways to reach your goal in IR, and I would strongly encourage you to apply to both.
Yeah, I really don't think that this is much of a question. I think it's absolutely, I would advise to apply to both, just because of the flux that's going on right now. You'll end up getting, if you do, the IR programs are going to be very competitive. So if you do end up going to the DR, do not worry. You will 100% have the same opportunity to get the same amount of training with the new ASIR that's going in. So yeah, what David just said, I couldn't agree more. I think it gives you the best chance. I think it gives you, it opens more doors for you, and there really is no detriment to not applying to both. So I strongly recommend that you do, especially right now with everything being so new and changing.
Agreed. Definitely apply for both. It'd be silly not to. I would also encourage you to apply to both within the same residency. Like if you're applying to UVA, for instance, just because I know that one, you should apply both to the clinical or the IR pathway as well as the diagnostic radiology program, because that program wants to know that you don't just want to go there for the IR, but you want to go there because you love something about that program, whether it's at City or the diagnostic radiology or whatever, but they want to know that you're dedicated to their school.
Yeah, I completely agree. I think that there are a significant number of IR programs that had been approved for the IR residency, but I might be a little off on a number, but I believe that the NRMP this year there's only 8 programs that are on the ERAS for direct application into the IR residency. So it's going to be lagging a little bit, even though these programs have been approved, because they have to work a little kinks out of their programs. So I would say definitely go ahead and apply to both DR and IR. Make sure to check the SIR website to see any updates on newly approved IR residencies as well, because these programs will probably allow transfers within their own programs as they go along.
All right, awesome. On to our next question here.
And you're not going to be successful at it, because if you do what we talked about earlier, that you're going to show your love for IR from your first year on, you're not going to be able to hide it. But you should most definitely apply for both. And even in the same program, you should apply for both if a program offers both DR and IR, because they want to know that you want to go to that program and not just only for IR because they have a good IR pathway, but if you could, you want to go there for diagnostic too, because it's that good of a program that you want to go there.
I completely agree with Nikki. I think it can be it's going to be a difficult, delicate dance for some of these programs, because when I was applying, actually, it was very difficult because Michigan asked me straight up if I would prefer to do IR or DR, and if I wasn't doing IR, would I even want to come to Michigan? So it was a very difficult spot, and I knew in my heart that I wanted to be at Michigan no matter what. So you have to tell them that you're more interested in IR, but you're still interested in DR because they have a wonderful DR program. But again, like, you have to make sure that they know that you like IR more than DR still. So it's just a really fine balance, and you guys might run into this when you start applying. Yeah, if you guys need to talk to us, just let us know. You can reach out to us, and we can try to give you some guidance.
Okay, great. And just like Alex was saying, she's posted a link to the some frequently asked questions on the IR residency in the group chat box, so you guys have that available to you there. All right, moving on to the next question. Did you say you were solely interested in going into IR and DR at program interviews? If so, how did the DR programs respond? And I can go ahead and start with this. Just from my experience, I was pretty upfront that I was going into it solely for IR, and obviously when I was applying, it was mainly just DR programs out there, and I'd say 99.9% of the programs responded positively or neutral towards it. I maybe had one program that kind of seemed like they didn't appreciate to hear that, but I think overwhelmingly most people understood that this is just kind of something that people have interest in, and you're going to have a lot of applicants coming in that just really want to do IR. And why don't we continue, Alex, if you don't mind going again, and we'll go Alex, Nikki, Rupal, and then start again with Andy down other portion of the list.
Yeah, so when I was asked this question, which it wasn't often, honestly, I think out of all my interviews, maybe only one program asked me of my interest. And I was honest. I'm honestly interested in both IR and DR. IR more so, of course, but I think DR is a humongous part of your training. And you guys will see that the first 3 years of your IR residency is going to be DR too. And you have to have that solid imaging background to be a good IR anyways. So I think that I was being honest when I said I truly am interested in doing DR as well as IR. And I'm happy I'll be dual certified and be good at both, hopefully.
I was asked that probably almost every single interview I went to. And again, honestly, like you can't just be interested in IR. There's so much in radiology that you're not exposed to as a med student. It's not just reading CTs and chest x-rays. There's a lot of procedures in it. There's all these fluoro exams and mammo biopsies. There's all this whole other world of IR that you're just not exposed to. And so you have to be interested in that part, not only because it is interesting, but you're not going to survive residency if you don't actively engage in the radiology aspect of IR too. And so in diagnostic programs, don't lie to them and say, I'm only interested in IR, or yes, I only want to do diagnostic, but you need to be open to the experience of diagnostic.
I would agree with that as well. I think, you know, being interested in interventional radiology comes with being interested in diagnostic radiology as well. And I think that's kind of the beauty of interventional radiology. You're like this Renaissance physician who has great command of technical skill, of clinical skill, as well as imaging skill. And so I think on interviews, you should definitely express your interest in interventional radiology as what brought you to diagnostic radiology, if that's the case, which is what was the case for me. But also leave some room for exploring the world of diagnostic radiology, just to show that you're not an ignorant person or an arrogant person, but you're willing to learn and grow and explore, because as a medical student, you may not have seen the entire sphere of diagnostic radiology, and interventional radiology might have been kind of the hook to bring you into the world of diagnostics.
Yep, I totally agree. I got asked this on a good handful of my interviews, and I think the best thing is to be honest with them. One thing that you will all find as you go on the interview trail is be as honest as you possibly can, because little like lies or promises that you don't keep will come back to haunt you immensely. So, you know, I was honest with them, and in all honesty, if you go to their diagnostic program and you're interested in IR, you're still going to be a reflection of their program. And if you're a great applicant who's hardworking and you're going to do great things in your career, that's going to reflect really well for their diagnostic program as well. So, you know, I think just letting them know that you're interested in IR. But like everybody has said, you'll be amazed how much diagnostics is a part of interventional radiology. I mean, if you're going in to do a TACE, you need to know how to look at an MRA or a CTA and be able to figure out your vascular anatomy. And that takes some time to learn. So you know, you really got to know your diagnostic skills. So don't sell the diagnostic portion of your training short, and you know, make sure that the program director knows that you really respect the skills that you're going to need to cultivate in order to be the best IR doc that you can be.
Yep,
Yep, I agree.
Sorry, I'm sorry, Shantanu. You go ahead.
You're good, man. No, I got nothing more to add. Those were all good answers.
Yeah, same here. You know, for me, when I was applying, there also wasn't this this IR residency yet. So the programs where I were applying to wasn't as big of a question. But at the same time, you know, my resume and things had more IR things than diagnostic, so it did come up. And like everyone had said, you know, be truthful. But you know, also show why you're passionate about radiology as a field in general, and that's what I tried to keep my conversations going, is why I wanted to join their program and what I thought I can contribute to that.
All right, awesome. Let's move on to the next question here. Did IR programs ask you about what electives you were taking during your 4th year? So why don't we go ahead and start with Rupal, followed by Nikki and Alex.
Some did, some didn't. I think the electives that you take during 4th year should be for your own edification. Oftentimes, you know, this will be your last time to explore, learn about, you know, certain specialties before you commit yourself to radiology, interventional radiology, or whatever path you choose to pursue. And so, you know, if you're interested in learning more about EKGs and doing EKG elective, or you're interested in learning more about GI and seeing, you know, GI consults and seeing the clinical side of it before you dive into your interventional radiology, I think that oftentimes it's favorable to explore other specialties, and it should really be for your own edification as opposed to what a program would want you to do.
I was never asked what I was doing my 4th year. I think it depends on what school you go to as to what your requirements are 4th year. I just decided to do all IR as much as I could because I had such a thirst for it. And the other thing I would say is that you should take your 4th year and take vacation and travel the world or go and visit family and friends, because you're not going to get an opportunity like that in residency, no matter where you go or what program. But you should relax your 4th year before residency starts.
So the only thing I was asked was why I did not do an away rotation at that particular institution when I applied there for IR programs sometimes. So I think that's a very valid question when they ask. I don't know about the other panelists here, but I found IR a little later in my career. I was thinking urology, plastic surgery, just random hodgepodge of fields until I found IR and fell in love with it, but it was very late compared to some other applicants. So I think I didn't have the opportunity to do some of the ways that other people may have had a chance to do. And in a way, I think that may have hurt me at some interviews. So I think that is something that you guys should definitely consider doing, just ways at institutions that you're very interested in and that have a really strong IR program. Other than that, I agree with Nikki. I think, and also Rupal, you guys should do electives that you're very interested in that you might like it to do in the future. If EKG class is one of those things, go for it. I don't think that was mine, but and I think that you do need to spend time with your family and friends, because when you jump into your surgery internship, you won't have that time anymore.
Okay, awesome. So let's move on to the next question here. What specialties did you submit letters of recommendation from, and how many from each specialty? We'll go ahead and start with David, followed by Shantanu, Andrew, then Alex, Nikki, Rupal.
So I submitted, let's try and think now. I believe it was 2 radiology letters. If I recall correctly, there were 4 that were allowed. And so 2, I believe, were diagnostic. And then, I'm sorry, 1 was a diagnostic radiology physician who was the clerkship director of my away elective. The other one was the IR physician who I did an IR sub-I with at that away institution as well. I went to Ross University, by the way, so for anyone who has any international related questions, I may be able to help with that. So I did do quite a few away electives, as you'd imagine, although we did have some affiliated hospitals, particularly in Michigan. In addition to those 2, I did 1 family medicine doctor who I really just was able to get along with and get to know well. So I thought he would be able to provide more insight as to my, just general personality, whereas the radiology letters would be more geared towards my interest and, and more academic related things. And the 4th one was from a surgery attending who was my core surgery director. And so he, I hope, was able to comment on more of my, hands-on types of things and interests like that. And that would go back to doing, a prelim in surgery, just as an example. But yeah, those were, that was my letters.
I had a vascular surgeon, a trauma surgeon, a gyn-onc, and then 1 IR. And for me, it was more of just people I got along with. I didn't want to overwhelm my entire portfolio with IR, so I kind of wanted to get a good breadth of everything. Personally, I think with the IR residency, they'll like seeing other specialties, especially surgery. If you go to SIR or any other conference, you'll keep hearing this, that IR is becoming more and more like surgery, which I think is very, very true. So it's definitely good to get a couple, if you can, get a surgeon or 2 to write you a letter of rec. I don't think people care that much in diagnostic radiology either. In fact, I think if you have all radiologists, it looks a little weird, just because as a 4th year, you're not going to really impress anyone with your knowledge of radiology. So I think it's probably safest to get a good mix of everything. So, yeah.
Yeah, I had, I believe, 4 letters. 1 was from a DR at my medical school. 1 was from my IR mentor who got me into IR. Another was an ER doc that I was close with, and another was a pulmonologist that I was also close with. I think the really important things with letters, and this is really tricky, is obviously you want somebody who's like, if you go somewhere that has like an IR guy who's a big name but you don't really know them that well, the letter can come off a little generic even though it's from a big name. So I would really urge you guys to get letters from people who really know you and are really going to advocate for you, because these program directors read through these letters of recommendations. They know the generic letters. They know what everything looks like. So if they see one that pops up that someone's genuinely talking about you and is authentically recommending you for their program, that's going to hold so much more weight than a generic letter from a big name. And applying to the IR residency, as I would definitely recommend having at least 1 letter from an IR attending. Hopefully, in medical school, I would advise you that if you are interested in IR, to try to get a mentor at your home institution if you have. If not, try to reach out to someone locally to be your mentor and get them to write you a letter. But other than that, again, I think 1 from IR, at least 1 from IR, and then the rest should be from physicians that really know who you are.
Okay, when we go to Alex.
Touch in real quick. Oh, sorry, go ahead, Alex. I just want to emphasize that. I just want to emphasize that you should also get a letter from diagnostics. Like, you should get a letter from IR, that's great, but you're also applying for a diagnostic residency, and so you don't want to forget that aspect of it, and they want to know that you're good in diagnostic, whether it's from a rotation or someone you did research with or whatever, but you should also do that. Okay, your turn, Alex. Sorry.
No, you're fine. Yeah, I completely agree with Andy. So I got mine in family medicine, peds, OBGYN, general surgery, neuroradiology, and my radiology chair, who was an MSK attending. And I thought getting the letter from the chair would get me further than all the other recommendations because, you know, it's the chair and he's well connected. But I did not get to work with him extensively. I worked with him on one research project. So he knew me a little bit, but not too well. But the letter I got from GenSurge, we got along so well. I worked with him every single day. We went to middle of nowhere, Georgia farms to take care of patients. And that is the letter that pretty much got me so many interviews. And I think that you need to get letters from people that know you well, and that's a number one. Don't try to get big names. I think the person just needs to know you, and it has to come off on their recommendation.
I agree with everything that everyone said. I got a letter from the chairman of surgery just because they take into account all of your experiences from your surgical rotation, and because I was applying to general surgery intern year. I also got a letter from a transplant surgeon that I had worked with who had kind of been pivotal in helping me realize I wanted to IR. I got a letter from one of my research mentors, and then I got one from an institution that I did an IR away at. That being said, sometimes the ways that you will do might not be in time for you to get a letter and submit it through IRS, but you can always ask your letter writer to send it to the program afterwards. Whether it's going to be read or not is up in the air, but I think that having kind of a variety of letters with physicians that you've worked closely with to demonstrate your interest in interventional radiology kind of from multiple perspectives, whether, you know, it's from an ED doc that you work closely with or a surgeon that you work closely with, I think could go a long way.
Okay, let's go on to
I
our
don't know,
next
I guess
question.
I already said my tidbit. Go ahead.
Oh yeah, if you have anything else, Nikki, go for it. If not, we'll go ahead and move on to the next one.
No, go ahead.
All right.
Go ahead.
Sounds good. So how many programs did you apply to or would you recommend applying to? And we'll go ahead and start with you, Alex, followed by Nikki, Rupal, then Andy, Sean, Canoe, and David.
So I honestly cannot remember, but I think it was 25 to 30 that I applied to. And yeah, the last few numbers were because I was freaking out because I wasn't getting some interviews and everyone else was. Don't do that. Just set a number and apply. And then I think I interviewed at 13. And I did 8 prelim interviews. And I think that's a really good number. By the time you're at 12 to 13 interviews, you're going to burn out. I did not believe it until I got to that point. And I got lucky because Michigan was my 13th program that I interviewed at, and it was my last one. And by that point, I was done. So I think you should just know your limitations, and can go to 40 interviews, go for it. But I think, yeah, don't tire yourself out because you're not going to do well in your interviews.
I think it depends on how strong you feel your application is, depending on board scores, research, letters of recommendation, etc. I originally applied to like 40, and then radiology interviews come out late, and so other people were getting them and I wasn't, and I freaked out and I applied to like an additional 30, which is ridiculously stupid because it's such a waste of money. But in the long run, it's better to match than not. I interviewed at, I think, 16, which is way too many. I only interviewed at one prelim program because I only applied to GenSurge once. I was able to do some over the phone and Skype, and ultimately felt as though GenSurge, it wouldn't really matter because you can scramble in. But that being said, it probably does matter a lot because you want to be at a good GenSurge program that supports you and allows you to do procedures. So it's maybe not the way you should go about doing it. think those are the only questions. Yeah, just wait for the applications to come in, your interview offers, because they come in late, and applying coast to coast can get very expensive. So, okay.
I applied to 20 to 25 programs for diagnostic interventional radiology, and then I applied to about 10 prelims. I think one thing that I would change if I went back is the prelim programs that I applied to were decided basically based on the institutions that I had applied to for diagnostic radiology or interventional radiology. And I think reflecting back on it, I'm happy where I am right now, but I didn't feel like I had that many good options in terms of getting good experience during my prelim year, considering that I wanted to do general surgery only. So I would say, you know, do your homework and definitely seek out a prelim year that's going to be very, very useful, because that will be your 1 year before you kind of like dive into diagnostic radiology and interventional radiology. It'll be your 1 year to see everything outside of the world of radiology, or you know, just kind of like make it the best year that it possibly can be in terms of how much training you're going to get clinically. So, you know, go for a program where they value you as a prelim, and you don't get shafted, you know, at the expense of others who are in the categorical program. So, you don't have to interview at that many prelim programs, especially if you're doing general surgery, but make them count.
So with the couples match, I believe I applied to somewhere in the 40 to 50 range, which is outrageous. It gets, like Nikki said, something that you all need to keep in the back of your minds is this gets extremely expensive. Not only the ERAS application fees, just for adding more programs, it starts going up to, I can't even remember how much it is a pop per program that you add on once you get above a certain number. But then you've got to, you know, fly everywhere. A lot of the diagnostic programs don't pay for a hotel or anything. You usually just get a discounted rate, so that's on you as well. Interview-wise, I think I went on around 20, and then I ended up canceling a bunch because, and that's another thing too, is you don't want to. I just felt really bad about canceling interviews that was late in the season, but if it does come to that, please know that the programs totally understand, and this happens all the time because, like Alex says, you will get burnout. I know that everybody's like really amped to go interview at all these places and see what everything has to offer, but I promise you, you will get burnout, and you can actually see it in the rest of the applicants' eyes at the end of the application season. Everybody is just so done. The residents who are like taking you around on tours, they're tired of it as well. It's an exhausting marathon. So really think long and hard about where you want to apply. And like I said too, other specialties will start getting interviews. You'll have co-med students that get like an interview before you at the same program. Don't freak out. You know, let everything take its course. But I would try to keep it to a very reasonable amount of programs for your own sanity, and then also for your wallet is really going to thank you as well. Prelims, I pretty much knew where I wanted to go, so I actually only applied to 2 in Columbus, and I had a pretty good relationship with them, so I felt like I had a good shot about getting in there. But I know a lot of people actually didn't match prelim years in my year, so I'm not sure if the medicine ones are still competitive, but for like we said, recommending going into Gen Surg, you should be okay being able to get a spot, and a lot of the other done through Skype.
So for me, I had a unique situation. My fiance lived in Pittsburgh, so I kind of had to be in at University of Pittsburgh for both my prelim and my radiology. So I got in touch with both the prelim program director as well as the radiology program director like a year in advance to kind of let them know that this was happening, that I wanted to be there, etc. And the prelim surgery person didn't even interview me. I kind of just was waiting until January until I emailed him saying, hey, like, you remember that conversation we had that one time, right? And he emailed back saying, oh, sorry, yeah, you're already in. And this is like 2 months before I matched. So, so yeah, if you know for sure you want to be at a particular program for prelim or radiology, you know, let them know. With that said, because I knew I wanted to be at UPMC, I only applied to 15 programs, which in retrospect was super nerve-wracking. I'd probably apply to more if I could go back and do it again. It worked out, but it made for a very stressful 6-7 months. So I think 20 to 25 is probably like a good sweet number. I went on 11 interviews, and I went on only obviously one prelim interview. So I think one thing I would say is if you do have a reason to be in a particular city, whether it's Columbus for Andy or Pittsburgh for me, it takes a lot of, or it does a lot for you to get in touch with that person, the program director, well in advance. You got to realize everyone's emailing program directors in application season. When September hits, they're going to get inundated with like emails from 1,000 people. But if you get in touch with them in like April or May or June, and you let them know before you even apply, like months in advance, that you want to be there, that makes a big difference. So have a sit-down meeting with them, even that helps too. So that's my 2 cents.
I totally agree with Shantanu. I think one of the key things is to express a clear interest, not only like we had been saying in the field itself, but in any particular programs, and show them why you may do that. And another thing that would be extremely helpful would be to try and do an away elective at any of these particular institutions, to get your face there and show them, you know, that's the ultimate interview in some ways. For me, I applied to a higher end number of programs. Like I said, I went to Ross University, so being an international graduate, you know, naturally applying more broadly. And I applied to about 40 programs for diagnostic, and I applied to about 30 for prelim. And I interviewed at about 13 diagnostic programs and 8 to 10 internal medicine preliminary programs. And like everyone's saying, it is very expensive. I was lucky. I did apply in primarily the Northeast area and the Midwest. Those were my 2 interests and in where I wanted to be. And luckily, there's a lot of programs in both. So I was able to still kind of, in a way, apply broadly by applying to so many programs. But I think it is also individualized, like in my case and for certain people, to just, you know, try to understand, you know, what, you know, it's a very competitive environment. So, you know, each person is a different individual.
Okay, great. All right, so we're about to start the audience submitted questions portion of the webinar. So just to go over some information here, please type your questions into the provided chat box and send directly to me, Akhil Khethrapal. When asking questions via the chat box, please indicate if you would like to direct the questions towards an individual or the whole group. And if you wish to ask questions to specific individuals but would rather contact them directly offline, please contact them via the shared contact information, which we'll show at the end of the webinar. So while you guys are starting to submit your questions, Shantanu, I know you were on call and jumped on at the tail end of the your question, and you had expressed wanting to answer that. So while folks are typing in their questions, why don't you go ahead and give your input on that?
Yeah, so I was actually one of those guys. I was gung-ho prelim surgery going into my 4th year of med school, and I've been asked by multiple people whether I regret my decision a month and a half in. And I've thought about that a lot, because there are definitely days where I do regret it. But at the same time, if I could do it again, I would absolutely do it again. Prelim surgery, so you got to pick the right position, or the right programs. That's key. And the way to really, I think, go about doing that is do not go to a big program. If you're one amongst 10 or 11 interns, your experience is going to be super diluted, and you're not going to get a whole lot out of it. The program I'm in, it's a community hospital in Pittsburgh. There are 7 of us, and 7 interns total, and 4 of us are prelims and 3 categorical. So you kind of have to treat the prelims well, otherwise you have half the intern class kind of rebelling against you. So pick your programs well. If someone asked me today if should you do prelim surgery or medicine, I'm going to say surgery just because the amount of experience you get is so the experience I'm getting is I could not have gotten that in a medicine program. Simple things like just putting in chest tubes or getting into the OR and just practicing suturing. Those are simple skills that translate over to not just IR but also diagnostic radiology. The other big thing is radiology is an integral part of surgery, and I'm already getting a good sort of getting my feet wet with radiology just with how much imaging is ordered by surgery. And finally, I think it's great to get an understanding of how your surgical colleagues interact and what frustrations they have with radiology and IR. Getting that perspective, I think, or I hope so, will kind of change how I react to or behave with my surgical colleagues in the future. So, yeah, I would definitely recommend a surgical internship. Just pick wisely.
Great, thanks, Antonu. And just while you guys are thinking of questions or in the process of submitting questions, just wanted to make sure you guys knew that we will be having another panel format discussion at the end of the month, and it'll kind of be a similar panel discussion, except this will be with program directors. So if you have kind of questions that you feel would be more appropriate to direct towards a program director, you can save those for them. Again, we're happy to answer any questions as well, but just to make sure you guys are aware that there will be a program director panel webinar for you guys to get some perspective from them as well. And we'll go ahead and give some time to have some questions come through. Haven't seen any come across just yet.
I guess while we're waiting, the one thing I would add to the comment is that you want to try and find a prelim program that gives you hands-on experience. And I know we've kind of already said this, but like even asking in your prelim interview to see like how many average procedures a gen surg prelim or an internal med prelim get to do during their procedure or during their year there. And I know in my experience at UVA, I did over 100 cases where I was the second scrub with the attending, not like a third or fourth person retracting, which is not like a great experience for you. But you want to learn how to do not only the IR cases, but the gen surg cases too, so that you have that breadth of experience going into radiology and IR.
Okay, I think we've started to get a good amount of questions coming through now, so we'll go ahead and start that portion of the webinar. So I guess how we'll approach this, I'll read out the question, and if somebody wants to just go ahead and start answering, we'll go from there. Obviously, if there's a specific question directed towards a specific segment of the group, we'll direct it towards there. But if any of you guys on the panel just have insight on the question, just go ahead and chime in. All right, so we have a... just give me 1 second here. So we have a question saying, our IR-DR interest group advisor, who happens to be a DR attending, thinks that doing an away rotation can hurt you more than benefit because as a med student you don't know much and you won't impress them a lot. What do you guys think, and would it hurt you if you don't do any aways?
I totally
say that.
All right. I totally disagree with that. I heard that rumor too when I was applying for DRs. I'm not sure if that's like a old like standard radiology thing that like you don't do aways in radiology. But I mean, I think going somewhere and showing that you're passionate and willing to work hard, I mean, I don't understand how that's going to hurt you. So I would not agree with that statement.
Yeah,
I would suggest
agree.
trying to do.
Go ahead.
I would suggest trying to do an IR rotation at your school first, so you kind of learn about the different procedures, learn about the different tools that we use, and that way when you go somewhere, you can go and impress them because you've already learned all of this other stuff. So I would highly recommend doing an IR away. I'm not so sure about a diagnostic away. I would leave that up to your program as to whether or not they would suggest that, because I'm not sure how much you can impress them sitting behind a resident trying to learn diagnostic.
Yeah, I actually heard that too. I was told by multiple people that I should not do an OA at UPMC, and I still went ahead and did it. I think for me, that was probably the biggest reason why I ended up matching her, just because how else are you going to get a one-on-one time with attendings? And it's not as important to know your stuff. I mean, it's important. Obviously, it's really good if you know your stuff, but I think it's far more important that you can get along with everyone, get along with the residents and the attendings, and they seem to like you. You can joke around with them and whatnot. I think that's far more important. So for sure, do an OA. I agree with Nikki. For sure, do a rotation at your home institution first. At least understand the lingo and how the flow of the day goes, and then kind of use that foundation to go do a OA wherever you want to go. I think with IR, especially now with how competitive we are all expecting it to be, I think we would kind of liken it to urology or ENT, where it's almost kind of weird if you don't do an OA. And it might be still too early to tell, but I definitely think that the way things are looking with the number of spots there are going to be, and how competitive we all expect it to be, sort of take a note from urologists or the urology residency programs and people going into urology or ENT, and kind of follow suit with what they're doing. If they're doing OAs, then I really think we should be doing OAs too. It might hurt you if you do really poorly, obviously, but then you got to know yourself best. If you feel like your personality kind of rubs you the wrong way, then maybe not. Maybe you should just kind of do an OA or do a rotation at your home institution and hold off. But I did have one person that I know that did an OA, and that did not match there, despite him going all in for that one program. But that's just one out of, 50, 60 people I know that did OAs. So the odds are definitely in your favor if you do an OA and you do well. So I would definitely say do an OA.
I think in my experience, I haven't really found a good correlation between people doing OAs and matching at certain programs, and I think it goes kind of two ways, from your end and how you end up making your rank list based on programs that you did OAs at versus programs you didn't do OAs at, and then from the program's end as well, as they compare you as an applicant that they know for a month versus an applicant that they know for a couple of days. So I think for me, having done the IR OA rotations, it was extremely, extremely valuable in that I was doing it because I wanted to learn. I wanted to know how IR is practiced in a different hospital and different institution with a different set of values. And in addition to that, I think globally, you are not expected to know a ton. If you're a good medical student, if you're enthusiastic, if you're willing to be the first person there, the last person to leave, you're willing to round on your patients, and you're willing to go the extra step, you're going to be looked on favorably. And so I think in that case, it can be a win-win situation if you decide to pursue residency at that program and that program decides to pursue you as an applicant.
Okay, awesome. Anybody else have anything to chime in for that question? Okay, if not, we'll move on to the next question here. And just for the audience members, just want to make sure you guys know that we definitely are seeing all your questions. So things like Step 1 scores and Step 2 scores, definitely not ignoring that, but I think that'll be better directed towards program-directed webinars. So we're going to make note of that and make sure that those questions are passed on to the program director webinar as well. So they are there. We do see them. So if we don't actually answer those questions in the resident webinar, it's something that we think just would be better suited for the program director webinar. This question is directed for Alex, Nikki, and Rupal. Did you guys have separate letters for IR residencies? And we'll start with Alex.
Yes, I did. I had my radiology attendings write ones that were specific for IR, as well as my Gen Surge attending. It's just, like Shantanu said, the personality that goes into IR can be a little different. So I needed a letter to reflect my surgical skills and my clinical abilities to patient care. So I think I think it's important for you to gear your recommendations to IR?
I did not have separate letters of recommendation, but I did have a separate personal statement for IR or DR, kind of catering my interest and skills to each program. And then I also had different ones based on West Coast or East Coast or Southern or Northern, and kind of I had like 6 different personal statements.
I did not have separate letters of recommendations just because a lot of the programs that I was applying to for interventional radiology were the same programs that I had applied to for diagnostic radiology, so it didn't really make sense, and sometimes the people who sit on the admissions committee can be the same people, so I kept the letters the same. In terms of personal statement, I had 2 versions, slightly tweaked, but essentially the same. The IR personal statement just capitalized a little bit more on my clinical experiences and why I was interested in interventional radiology. And I did not have different statements for different geographical locations. So I had 2 different personal statements and all the same letters of recommendations.
Okay, great. So we'll move on to our next question here. And this question, directed towards the whole panel, is what do you think the value of professional society membership is at this point, and attending meetings such as RSNA or SIR, or joining professional societies such as SIR? And we'll go ahead and open up to the whole group, and we'll have about 2 people answer this. So the first 2 folks who answer, we'll go ahead and stick with those before moving on to the next question.
I think that is incredibly important, incredibly important. I think even looking at the fellowship selection process here, I know that they won't even look at the applicant if they're not a part of RFS. It's a very small group of people, and everyone knows everyone in IR, and I think that it is important for you to be involved locally as well as nationally, and that is going to go very, very far. So I would recommend you guys to go ahead and get involved in MSc and RFS, and locally at your state societies as well, and really spread the word of IR, because that is really going to shine through on your application.
Yeah, it's...
Cannot reiterate.
Yeah, it's huge.
Sorry.
No, go ahead, Nikki. Absolutely huge.
Yeah, agreed. I cannot reiterate enough what Alex said. Not only do you make like this impression on IR, but you get so many contacts from around the country and the world, and see what IR is at different places and what they're doing and their experiences, and it just grows you as a future IR.
Okay, we'll move on to the next question here. So this will be for the folks who applied for both IR and DR programs. How will programs handle interviews for IR and DR at the same institution? And from your experience, were you able to interview for both on the same trip, or did you have to do separate interviews on separate trips?
At UVA, the way that they did it when I interviewed is that you just had 1 additional interview with an IR attending, but everything else is the same.
Okay, anybody else have any experience with that?
At Michigan, I applied and I interviewed with 2 IR attendings in the morning, and I interviewed with 4 DR attendings in the afternoon. So it was mixed.
Okay, great. Next question. So I want to ideally apply to an integrated program that has great DR and IR experiences. How do we know what the best DR or IR programs are? Is it only word of mouth, or is there an objective ranking out there? So I guess to kind of frame this question for the panel, when you guys were considering your residency programs, what information did you use? Was it mainly based on your experience in your interview, or did you have some sort of objective metric that you were looking at beforehand?
There are so many people that will try to rank it. I'm sure you guys have all seen like Doximity or stuff that will try to rank these residency programs. But I mean, as much as the exhaustive search that I went through, I'm sure you all will, there is no ranking system out there like there are for medical schools. As far as knowing which ones are really good at DR and IR, personally, I learned that most through word of mouth, talking with people who were a little bit more advanced in their career than I was. Talked to my mentor when I was in medical school about which ones were had a really good balance and where I should apply to. So that's how I learned.
Okay, anybody else have any experience with that? And just for the audience members, I just sent a link to the whole group here. It's a link to the RFS website just talking about the RFS and ways to get involved. So there's a link available for you guys there if you want some more information as far as the SIR-RFS. Okay, and this is again for the whole panel here. So when applying to the DR, IR, and prelims, which months of your M4 years should be relatively open for interviewing? So again, to frame the question for the panel, did you guys notice a trend in common interview months, I guess both for the IR programs and the DR programs? Were there certain months where you felt like they're more interview heavy? Or did you just notice no real general trend is kind of spread out throughout?
I think November.
Go ahead, Ripple.
So for me, November to December were kind of the most heavy. My first interview was in late October, and then my last interview was in late January. Kind of depends on how many interviews you end up going on, but you will have weeks where you're interviewing like 3 days a week, and in the interim you're traveling from place to place. But in general, I would say try to get step 2 out of the way so that you're not studying and interviewing at the same time. And try to do your aways early so that you're not leaving an away to go to an interview or having to reschedule an interview because you're at your away. But I think definitely like late October to late January will be the span, with November, December being the heaviest months.
I agree. I found that most California schools specifically offer interviews very late, and the majority of them are in January.
And I think it would be good to ask this question during the PD session too, because I think the process might get even earlier, but again, it might be best reserved for that session. And I would try not to schedule your away rotations during that time, because it might look really bad if you had to leave constantly for your interviews, unfortunately. And you're going to be on your phone a lot checking emails for those invitations, and that could seem like you're not paying attention, unfortunately. That's just, yeah. So I would avoid away rotations during that time.
Okay, this question is directed for the whole panel. When it comes to research, do you recommend doing radiology research only, or doing research in different fields of medicine?
So I actually did. I did a couple projects in IR, but they were kind of just flimsy, not really high yield, high impact projects. I did do a lot of research in vascular surgery, just because OSU, I went to med school, had a really strong vascular research program. So, and that was kind of a safe bet for me. And I think Surgeonc is similar in that there's a lot of overlap between those fields and IR. So you can definitely kind of spin your research in a way that can be IR-centric. With that said, I don't think it really matters. I think research is research. IR research definitely helps, obviously, but I completely understand that some programs don't have very robust IR research programs. So if you are at a med school where they don't do a lot of IR research, I don't think it's any reason to be afraid or panic. I think you just try to get in on something that you find interesting. I enjoyed Endovasc, so I got involved in vascular surgery, and I did a bunch of projects with them on EVARs and whatnot. So I don't think it matters that much what you do research in. So do what you can.
Yeah, I agree.
I think generally.
Go ahead.
Sorry, go ahead. No, go ahead.
I was just going to say quickly, doing research is important. What you do it in is not really that important, just because IR and DR are so diverse that you can talk to a radiologist or an interventionalist about your research, and they will find some way to connect with it. But I think doing research in the end is very important.
Okay, Alex, did you have something you wanted to add to that?
Yeah, I actually talked to some of my interviewers after the whole thing was done, and they told me that they were honestly looking for people who had the capacity to do the research and finish it, more so than what kind of research they did. So that's what you guys should focus on, just, you know, getting through it and actually getting it done without just starting something and just letting it hang.
Yep, and I'd also just like to add one more thing. This, I guess, I don't know if it would technically fall under research, but it's also kind of activities. And we had spoken about the importance of being on committees and things. So something the RFS has done in SIR is these projects where you become involved in kind of these educational things. And those were major talking points for my interviews with various survival guides or journal primer projects that various things. And so these are very enjoyable projects that I gained a lot out of. And although I wouldn't classify them as research, I think they're also a great thing to add to your application.
Okay, next question. So we've had a couple questions kind of on this theme, so we'll just go ahead and kind of lump them into one. So as far as advice for med students applying from international med school programs, is there any advice that the panel has?
Sure, so I guess I'll start with this one since I'm the IMG in the group. I had mentioned, you know, applying broadly is always an important thing given that the scope of the applicant cycle. I think also what really benefited me, we also touched on this earlier, was as being in an international graduate, you may have some opportunities to do some away electives in third or fourth year. And personally, during some of those, I gained a lot of personal experiences and became, you know, friendly with a lot of the residents and attendings at a couple of these particular programs. And that would certainly have helped me when in the application process. Trying to think more specifically, you know, as an international graduate, you kind of have to take initiative because oftentimes you need to look for things when it comes to even research or various things. And that's one reason I in particular reached out to the Resident Fellow section a few years ago and became involved in the pain management service line. And so those would be just some things. Take initiative, and you know, when you have your mind set on something, you know, just do things to, you know, increase your knowledge in the area and show that interest.
Okay, and this is something we did touch on during a portion of the frequently asked questions, but just to kind of hammer home the information, looks like a lot of folks have questions on it. Did you guys do separate personal statements for your prelim year?
I guess I'll just reiterate that, yes, I did one gen surge and one, or I'm sorry, I did one, actually I did one gen surge prelim, I did one IR, I did one diagnostic, and then I catered each one of those to the region, because you're going to California and you're from upstate New York, they want to know why you want to go to that area, not just because California is cool.
I also wrote a separate draft of my personal statement, but it was more so along the lines of why general surgery would prepare me for the career that I have chosen to pursue. So it didn't really require that much tweaking for my interventional radiology personal statement. And I think, you know, a good general surgery prelim program will really respect that connection that you make between general surgery and interventional radiology.
All right, anybody else have anything to add to that? Okay, and just to reiterate, we definitely, I have all your questions that you submitted, just questions that are kind of more focused on logistics of the new residency training pathways and things like board scores, and things that just seem better directed towards program directors. We will kind of forward to that webinar to inform you guys that webinar will be on August 29th. That's a Monday coming up in a couple weeks, and you'll be seeing advertisements for that as well. And again, that will be a similar panel discussion featuring various program directors. So I think this will be a good stopping point, just going through the questions that we have. Is there anything else the panel wants to add?
Good luck with applications. You guys will do great.
Yeah, thank you all for coming.
Hey, y'all.
Everything.
Enjoy fourth year, please, guys.
Definitely. And just
Do you
here's
guys
the
have
contact
any
information for the various panel members. Sorry, go ahead.
If you have any pressing questions for any of us, our emails are at the end of this PowerPoint, and please feel free to email any of us if it's just a general question or if it's about our specific program.
Yep, definitely. Thanks to all the panel members again for volunteering your time. This, I think, was a huge help for everybody, and thanks for all the students that came out. Hopefully this was helpful for you guys. And like everybody said, if you have any specific questions, here's our contact information. Please don't hesitate to get in touch with us. We'd be happy to talk to you. And we'll go ahead and end the webinar from here.
Thanks, guys. Have a good night.
Thank
Thanks,
you.
everyone.